section, we're going to talk about the anatomy of the nasal cavity itself. So here we have the sagittal section through the nasal cavity, where you can see very clearly the nasal conchae that we talked about when we learned the skull, the superior, middle, and inferior. And this whole cavity and all of these ridges are lined with pseudostratified ciliated columnar epithelium with lots and lots of goblet cells. And of course, remember that goblet cells make mucus. So that means this whole nasal cavity is lined with mucus. And because of these ridges and the mucus, that's going to help to create turbulence, which slows down the air moving through this nasal passage as you breathe. By slowing it down, it helps to warm it up and humidify the air. And especially since there's all this mucus, that mucus transfers some of that moisture to the air that's passing through. The nasal conchae are also really important because they increase the airflow to the olfactory receptor cells. And you remember those are up here going through the cribriform plate into this epithelium here. So with more air traveling up to those receptor cells, you can smell better, which is why they're much more complex in other animals that have a better sense of smell. So in the human skull, these conchae are pretty simple. They're just little ridges. In other animals, such as this clouded leopard from the Cincinnati, I believe, Museum of Natural History, you can see much more complex bones, which are called turbinals because they do create a turbine kind of effect, so that a lot more air swirls through the nasal cavity, gets to those olfactory receptor cells, leading to a better sense of smell. Back to the humans. The vestibule is, you remember, a vestibule is just an opening of a cavity. The vestibule is that area behind the nostrils. That's the part you pick when you're picking your nose. Don't worry, you can't get your fingers back here. Your fingers are too big. The hard palate is the bottom of the nasal cavity. Remember, it's also the top of the oral cavity, and it's created by the maxilla and the palatine bone. Of course, you remember that. At the back of that is the soft palate, which you remember is just hard tissue, or tough tissue, not hard tissue. And this is going to lift up to block food from going into the nasal cavity when you swallow. And the little bit that flops up is called the uvula, which you can see here in this cartoon with Jerry Mouse, who just got caught by a predator. There's the uvula at the back of the predator's mouth. And that little thing flips up across this opening to prevent food from going into your nose when you chew. If the uvula doesn't completely block that opening, or if you're laughing so hard that you're trying to breathe and swallow at the same time, then you can get food into your nasal cavity, or, you know, for example, shoot milk out your nose. That's how that happens. This is the nasal septum. Remember, this is the middle of the nasal cavity. So the conchae here are the lateral sides. This is the medial part of the cavity. And you remember it's made of the perpendicular plate of the ethmoid and the vomer, that's the bony part, and then the cartilage, the septal cartilage that finishes that nasal septum. The sinuses are found around the nasal cavity, and of course they're named for the bones they're in. You remember that from when we studied the skull. We have the frontal sinus, the sphenoid sinus, and then the maxillary sinus that kind of sit here but more laterally. We're going to stop there, and next we're going to talk about the pharynx, or the area of the throat.